Hi, so my name is Carolyn Bradley. I am a PhD student at Palo University in their clinical psychology program, and I'm the primary author of this poster, and our co-author is Dr. Janice Haybarth. The title of this poster presentation is Somatic Arousal as a Mediator Between Trait Mindfulness and Pain Catastrophizing. So, what is pain catastrophizing? Pain catastrophizing is a tendency for somebody to ruminate or magnify or feel helpless with regards to their pain experience. So, we know that pain catastrophizing is associated with numerous adverse outcomes, especially as it pertains to mental health. It's highly associated with depression, mood disorders, trauma, substance use disorders such as, opioid misuse, alcohol misuse, and anxiety disorders. It's also highly comorbid with suicidality. Pain catastrophizing is also related to adverse physical health outcomes, such as poor prognosis from medical intervention, poor, outcomes related to chronic pain, greater physical disability as well. Pain catastrophizing is also associated with poor quality of life, especially as it pertains to social isolation or employment. Many people who have a tendency to catastrophize their pain find it difficult to sustain or revisit employment or finish education, and they tend to have a hard time reconnecting with the life that they lived, whether that was, being involved in certain social groups, sports, things like that, and community as well. So the constructs of this study included trait mindfulness, somatic arousal, and pain catastrophizing. We knew that trait mindfulness is actually negatively related to somatic arousal and pain catastrophizing, whereas somatic arousal is actually positively associated with pain catastrophizing. So the hypothesis of this research was that somatic arousal would mediate that negative relationship between trait mindfulness and pain catastrophizing. Non-judgment of inner experience is actually a facet of trait or baseline mindfulness, and we use that as the mediation within this study due to it statistically mapping on very well. So the method of this study was that we actually utilize Amazon MTurk and Qualtrics as a means of administering this online survey. Eligibility requirements included being 18 years of age, fluent in English, having chronic pain, residing within the United States. There were 114 participants, and the measures we used were the pain catastrophizing scale, the five-facet mindfulness questionnaire 15, the physiological arousal questionnaire, and the CAGE aid. The CAGE aid measured lifetime history of substance use, as we use that as a covariate within our analyses. So the results indicated that our hypothesis was supported in that there was a significant partial mediation. Path A was non-significant. However, there was an indirect effect. Path A multiplied by path B that was significant. There was also significance between the pathway of substance use and pain catastrophizing. So what do these results indicate? These results indicate that we should consider baseline levels or trait mindfulness in people with chronic pain when considering, assessing for or treating people that catastrophize their pain. So more specifically, we should look at non-judgment. We should also consider their baseline levels of somatic arousal as well. So this research also suggests that interventions should be used to increase or boost trait mindfulness and decrease arousal. We should also consider patients' substance use history when assessing for and screening chronic pain patients, as well as those that we may have concern for pain catastrophizing for. for. So we know from the literature that substance use and chronic pain in general is highly comorbid. So these results make a lot of sense. Well, I hope that you enjoyed this poster presentation today, and this is the end of our poster. I'm sure you can access it through a PDF as well, and you can also use this code here to access the research paper. Okay, well, thank you and have a great rest of your day.